Hello, everyone. World Autism Awareness Day is celebrated every year on April of 2nd of April with the aim to increase awareness, acceptance, and inclusions of individuals with autism spectrum disorder. Autism is a complex neurological condition that affects communication, social interaction, and behavior. According to the WHO, an estimated 1 in 160 children worldwide have autism. It is important to spread awareness and educate society about autism to ensure individuals with autism can live fulfilling and meaningful lives. To mark this occasion, we are delighted to host a panel of discussion on Facebook with four distinguished medical professionals, Dr. Manisha Singhal, Dr. Meghna Phadke, Dr. Richa Jain, and Dr. Sakshi Gupta. These experts have years of experience in the field of psychology, pediatrics, and psychiatry. They will share their insights on autism, provide guidance on how to identify early signs, and discuss effective treatments and therapies. Dr. Manisha is a clinical psychologist and psychotherapist with 13 years of experience. She strongly believes that patient care is a top priority and strives to provide the best medical facility to her patients. Dr. Meghna Phadke is a renowned pediatrician with a special interest in neonatology, neurology, nephrology, hemato-oncology, and intensive care. She has been associated with various hospitals like Leelavatian Hospital, Mumbai, Sarvodaya, and Pak Hospital. Dr. Richa Jain is a professional psychiatrist with vast expertise in mental health care. She specializes in the treatment of all mind related issues, mental disorders, and counseling backed by her admirable experience in the field. Dr. Sakshi Gupta is an educational psychologist, counseling psychologist, and child behavior therapist. She has more than 11 years of experience in these fields and is associated with Metro Hospital and Cancer Institute in Preet, Vihar, Delhi. So join us for this informative and thought-provoking discussion as we strive to increase awareness and understanding of autism and promote gender acceptance, support for those affected by these complex conditions. Hello, doctors. So my first question to Dr. Manisha, ma'am, what are some of the common signs and symptoms of autism in children, and at what age do they usually appear?
या सो ऑटिज्म के जो सिम्टम्स होते हैं वो जनरली 3 साल तक अपीयर होते हैं और वो भी पेरेंट्स मे नो देयर इज समथिंग डिफरेंट अंटिल द चाइल्ड स्टार्ट्स गोइंग टू द स्कूल तभी वो रिफ्लेक्ट होने शुरू होते हैं वैसे अर्लीस्ट अगर देखा जाए तो 8 से 10 मंथ्स में भी वो रिफ्लेक्ट होने लगते हैं if the parents have idea if the other family members have got idea about autism कि क्या डिफरेंट है उसमें फीचर्स और सिम्टम्स इसके जनरली क्या होते हैं कि बच्चा कॉन्स्टेंटली अपने किसी भी चीज़ पे अपने हाथ पे या कोई भी ऑब्जेक्ट जो एनवायरनमेंट में है उसमें एटलीस्ट 5 सेकंड तक कॉन्स्टेंटली स्टेयर करता रहता है फ्लिकरिंग फिंगर्स इन फ्रंट ऑफ द फेस फॉर एटलीस्ट 5 सेकंड्स आई कांटेक्ट अवॉइड करता है he avoids looking away he looking away you know avoids eye contact jo so the child spins them the objects which are not designed other than that इसमें कुछ स्पीच इश्यूज भी कभी होते हैं या आईक्यू हाई एंड लो भी हो सकता है that this basically varies case to case और जब ये ऑटिज्म स्पेक्ट्रम डिसऑर्डर जो ये टर्म है इसमें स्पेक्ट्रम को मैं थोड़ा सा एक्सप्लेन करना चाहूँगी स्पेक्ट्रम बेसिकली ये एक रेंज ऑफ सिम्टम्स है इसमें ऐसा नहीं है कि सेम सिवियरिटी के साथ सारे केसेस होते हैं तो इस ज़्यादा होती है किसी में कुछ डिफरेंट होता है किसी में कुछ डिफरेंट होता है so this differs child to child case to case and it's a pervasive disorder and इसका जो कॉज है वो बहुत नोन नहीं है लेकिन कुछ ऑर्गेनिक चेंजेस होते हैं ब्रेन में जिसकी वजह से ऑटिज्म होता है
थैंक यू मैम, आपने कॉजेस के बारे में बताया एंड मैं डॉक्टर साक्षी से क्वेश्चन पूछना चाहूँगा कि मैम ऑटिज्म के क्या ऐसे कॉजेज हैं जो हमारे जेनेटिक एनवायरमेंटल फैक्टर्स को कंट्रीब्यूट करते हैं, और कैसे हमें पता चलेगा? डॉक्टर साक्षी, कैन यू हियर मी? मैम, यू आर... हेलो डॉक्टर साक्षी?
Yes, hello. Am I audible?
Yes, ma'am. Now you are audible. Yeah. So
Yes.
let me just ask
So,
once again the
yes.
question to you. Yeah. So what are the cause? What are the some of the causes of autism, and how much do we know about the genetic and environmental factors that contribute to it?
See, when we talk about the factor, we can say कि genetic, yes, इसमें बहुत सारी रिसर्च अभी होती हुई आई हैं, और कहीं ना कहीं जब हम देखते हैं कि ऑटिज्म का फैक्टर रीज़न क्या है, तो रिसर्चेस में यही दिखाते हैं कि इसके बारे में जितनी भी रिसर्च हुई है, जेनेटिक फैक्टर एक रीज़न है, लेकिन इसके बारे में कोई श्योरिटी अभी बहुत ज़्यादा कुछ रिसर्च निकल के नहीं आई है। लेकिन हाँ हाँ, हम लोग क्योंकि रीजंस नहीं पता होते हैं ज़्यादा, तो हम उनके प्रिवेंशन पे ज़्यादा वर्क करते हैं, दैट वी कैन वर्क राइट। जैसे अगर जैसे डॉक्टर मनीषा ने कहा कि अर्ली इंटरवेंशन की जब हम बात करते हैं, तो वहाँ पे अगर हम डिटेक्ट कर लेते हैं कि बच्चे को ऑटिज्म है, ऑटिज्म स्पेक्ट्रम डिसऑर्डर है, दैट इज़ ऑल्सो डेवलपमेंटल डिसऑर्डर भी हम इसको बोलते हैं। तो यहाँ पे अगर हम इसके अर्ली इंटरवेंशंस करें, तो उससे जल्दी हम उसके ट्रीटमेंट पे वर्क कर सकते हैं, थेरेपीज़ पे वर्क कर सकते हैं। एंड इसके साथ जो कोमोर्बिड डिसऑर्डर्स हैं, उनको भी अगर सही देखा जाए तो आइडेंटिफाई करके उस पे वर्क किया जा सकता है। जैसे कि ईटिंग डिसऑर्डर, इट्स अकम्पनी विद ऑटिज्म।
I guess we lost Dr. Sakshi in between. Uh, I guess there is some network issue with Dr. Sakshi. So, Dr. Meghna, as a pediatrician, what is your role in identifying and treating children with autism, and how do you work with other healthcare professionals to provide comprehensive care?
Right. See, as a pediatrician, we are seeing newborns. At the time of delivery, there are certain risk factors like birth asphyxia or any kind of birth complications, which can sometimes lead to such kind of autistic behaviors, and it is not predictable. We cannot say which children will definitely have those. So definitely such newborns and even normal newborn, they come for routine vaccination and routine growth and development monitoring. So at appropriate age where particular social and growth milestones are achieved, we assess for that. So for example, we talk about soft signs. Suppose a child has not developed any eye contact by the age of 4 months or so, it is too late. So we call it as the factors which will definitely appear. Generally, the eye contact starts around 1.5, 2 months. But if a child is failed to develop it even by 4 months of age, we take it very seriously. So likewise, there are other symptoms like expression, formation of gestures, joint attention, we call it, or even saying one word or awareness about the environment, whether the child looks around when called for name, if that thing is not happening. When we talk about what kind of stimulation is given at home, what is the home environment, we actually parents that they have to monitor for any other kind of signs or symptoms in this regard. At the same time, if we find that it is something which needs an intervention immediately, the team is involved, which of course includes clinical psychologist, developmental pediatrician, pediatric neurologist, etc. At the same time, it's the genetic factors which are related to autism. Of course, I agree that there are very few, but certain syndromes like Down syndrome or Fragile X, these are characteristic syndromes which have risk factor to develop autism. So clinically, if such kind of patients are there, we definitely involve them or screen them for such kind of problems. Other than that, there are certain sometimes, as Dr. Manisha had also said, it's a spectrum. So some babies they come to us only with inattention problem or only with hyperactivity problem. So if these kind of problems are there, testing. then we also screen them for other features of autism. So that's how we generally offer our help. In older children, as Dr. Manish also suggested, those newborns are not under our care, and we see the baby first time at around say 3 to 4 years of age. And if their cognition and their language and behavioral milestones are not up to the mark, then again, accordingly, we involve the rest of the team in that.
Thank you, ma'am. Dr. Richa, what are some of the most common co-occurring conditions that children with autism may experience, and how are these managed?
Okay. So, whenever a child comes to us in the OPD, so there are many presentations which we see in the OPD. So, they can also present with the core symptoms which are there in autism, like there's communication deficit, there's deficit in how they interact with other children and other people around them, and also there are many repeated behaviors, certain restricted interest with which the child can present. So, apart from the core features of the autism, the child can also present to us with different other symptoms of the co-occurring conditions. One of the most common co-occurring conditions with autism is the symptom of hyperactivity and inattention. So, hyperactivity in children it present in the children of autism. So hyperactivity can be directed around some certain goals, specific things, and also it can be very purposeless also. So it can be a part of ADHD also, and it can be a behavioral symptom also. So and apart from hyperactivity, the child also present with inattention. The जो उनका attention span होता है, the attention span that they have, वो उसमें बहुत lacking होता है, and because of which they have uh, severe consequences in how they perform their activities in daily routine and how they interact with the adults around them. And and other conditions which might also occur, this since the autism is a neurodevelopmental disorder, so child may also be suffering from other neurodevelopmental disorders like intellectual disability, in which there's a deficit in the intelligence of the child, and there might be deficit in the self-help skills which the child develop according to the age, and also there might be certain learning deficiency, there might be certain speech and language deficiencies which might occur. Apart from the neurodevelopmental disorder which can co-occur with autism, there are certain mental disorders also which can occur. And some of the mental conditions which can occur is there's a lot of irritability and anger issues which are present in children of autism. The irritability, since the children with autism, they don't do very well with change. If there is any sort of transition in their life, even if there is a slight change in their routine, the way they eat their food, the way they dress themselves, the route they take. So if even if there's a certain change in the routine that they follow, they don't do very well with change, and they get anxious and irritable. And uske baad, and after that, it becomes very difficult for the parents to manage the child. So there is anger and irritability issues. They might get anxious also. There are certain mood changes. We can typically in children of autism we see uh, without any stimulus also, sometimes they become very cheerful and they laugh out loud out of context, or they suddenly starts crying. So there are very variable mood changes that occur in the autism. Apart from that, there might be certain repetitive behaviors which occur in OCD, and there might be tic disorder and Tourette syndrome which might occur. And also, apart from neurodevelopmental and psychiatric disorder, there are certain genetic syndromes which present with the symptoms of autism also. Apart from the other symptoms which are inherent to that disorder, like Fragile X syndrome, or MAM said Down syndrome, or tuberous sclerosis. These symptoms can also present with symptoms of autism. So these are some of the major conditions which co-occur, which coexist with autism spectrum disorder. Yes.
Okay, thank you, ma'am. Dr. Manisha, what are some of the most effective therapies for a person with autism?
ऑटिज्म के केस में कुछ ऑक्यूपेशनल थेरेपी जो रिक्वायर्ड होता है, जैसे अभी डॉक्टर मेघना, डॉक्टर रिचा ने भी मेंशन किया कि उसमें कभी मसल एट्रोफी वगैरह ये सब तो कॉमन है। और स्पीच थेरेपी, कुछ केसेस जिसमें स्पीच अफेक्टेड होती है, स्पीच थेरेपी। एंड प्लस रेगुलर साइकोलॉजिकल थेरेपी जिसमें पेरेंट्स की भी काउंसलिंग रिक्वायर्ड है। इसमें साइको एजुकेशनल उनको कुछ सेशंस उनको दिए जाने चाहिए, या जो भी उनके केयर टेकर्स टेकर्स हैं तो उनको भी साइको, दे शुड बी ड्यूली साइको एजुकेटेड। और अदर देन दैट कुछ हम घर में ट्रेनिंग प्रोग्राम्स भी बच्चे के लिए प्रोवाइड कर सकते हैं, जैसे जो उसका बिहेवियर है उसके अकॉर्डिंग। जैसे अगर वो ऑब्जेक्ट्स लाइन अप करते हैं, इस तरह के सिम्टम्स हम बहुत कॉमनली देखते हैं, या स्टेयरिंग है, या फ्लैपिंग हैंड्स है, या हिटिंग है, या कुछ सेंसरी इश्यूज होते हैं, या इसके अलावा इरिटेबिलिटी, अग्रेशन, हाइपर एक्टिविटी। तो इन सब चीज़ों के लिए भी कुछ ट्रेनिंग प्रोग्राम्स जो रूटीन एक्टिविटीज़ है उसमें हम फोकस कर सकते हैं। सो अदर देन ऑक्यूपेशनल थेरेपी, स्पीच थेरेपी, ये सब भी हम कर सकते हैं बच्चे के लिए।
Thank you,
बिहेवियरल
ma'am. Yeah,
इश्यूज में रहते हैं, या सो बिहेवियरल थेरेपी इज सर्टेनली रिक्वायर्ड।
okay. So, thank you, ma'am. Dr. Meghna, how can parents and caregivers best support their child's overall health and well-being, including diet, exercise, and sleep habits?
Yes. See, first of all, as ma'am said, the parents' education is very important. They have to come down to an acceptance of this. Many times it is seen that they are not able to accept that symptoms are existing, and then that becomes a little wastage of time for the child, because the brain, develops nicely till 5 to 6 years of age. We call something called as synaptic pruning, means the habits जो हम उनको सिखाते हैं, जो एक predictable routine देते हैं, तो उनको वो adjust हो जाते हैं, and if it is having a good positive effect, then that becomes that remains with it, and the rest get deleted. So that part has to be very much nicely understood by the parents, that this is the time to intervene. If the doctor's team, the psychologist, developmental pediatrician all have insisted to start, they should take up it at the right time. Secondly, they can build up a child's routine. It really takes a lot of time of the parent also, because the involvement is absolutely necessary. They have to build child's interest, see what kind of hobbies or any specific interest the child has, and that can be augmented. Giving them a predictable routine is very important, because they resist any slightest change, as very nicely explained by Richa. Also, we have to actively encourage both the parents have to actively encourage each other to continue with the same. Timely occupational therapy, behavioral therapy, and those sittings have to be actually arranged and to be done. It's quite a challenge for parents, but वो उस time पे अगर किया जाता है तो then उसका consequence will be better. Regarding diet, generally it is said that the monoglutamates, excess sugar, everything has to be avoided. And monoglutamates is like what we generally see in a packed masalas, like a Maggi masala or anything. So excess use of that should be avoided. Then also gluten-free diet and casein-free diet. They sometimes irritability के symptoms को थोड़े improve करते हैं, ऐसा देखा गया है. So that can be done, and that has to be understood. Many a times, if the parents also slightly change that one or few items that they are eating, that also encourages child to go ahead. So accepting the child's routine by the family is the core importance. Apart from that, sleeping disturbances should not be there. Sleep is very important, and sleep hygiene should be monitored by parents and should be followed. Judicial use of screen. Again, screen time is a problem with the non-autistic children also nowadays. We are seeing autistic-like features in them because of excess screen use under the age of 2 years, where sometimes the symptoms are so similar, it becomes very difficult that why the child has really acquired it. So, screen time, even I would say it should be judiciously used. Nowadays, there are apps also available for babies with autism to teach them, like Be Able app or Let's Learn Autism, that kind of app. So these can be judiciously used or after consulting with the developmental pediatrician. That is what I would suggest.
Oh, thank you, ma'am. So, Dr. Sakshi, how can parents and caregivers best advocate for their child's need when seeking an autism diagnosis or treatment?
Well, first of all, the problem which actually autistic parents autistic बच्चों के parents के साथ होती है, mainly they are always mostly in denial. They don't want to accept the problem कि हाँ उनके बच्चे को disorder है या उनको autism है, because often we see कि when we diagnose a child and we see the symptom of autism in a child, तो सबसे ज़्यादा उनके साथ ये प्रॉब्लम आता है कि मैम ये तो आजकल के हर बच्चा करता है. That doesn't mean that child is not responding on the name, that child is not लाइक डेवलपमेंटल डिसऑर्डर है या स्पीच डिले हो गई है. बिकॉज ऐसे बहुत सारे केसेस हमारे पास आए हैं जिसमें कोविड के दौरान बच्चों का स्पीच डेवलप नहीं हुआ है, जो एक बहुत बड़ा सिम्टम है ऑटिज्म का. तो सबसे पहले मैं कहूँगी एक्सेप्टेंस इज द मोस्ट इम्पॉर्टेंट थिंग, दैट दे शुड एक्सेप्ट कि येस देयर इज अ प्रॉब्लम एंड वी नीड टू वर्क ऑन दैट. And when it comes to the preventions that we are talking, right? So they need to work on their sleep hygiene, as Dr. Manisha has said. Meghna has, sorry, Dr. Meghna said, and sleep hygiene should maintain on that, right? They need to work on the therapy at home as well. It's not that the child has been sent to the therapy session and they are not repeating the same at the home. They should follow the homework as well, because the child has to do the same exercises at home. And for example, अगर child brain jamming exercises अपनी therapy में सीखता है, that child should repeat these activities, these exercises at home with patience, with lot of because sometimes they want to do it, sometimes they don't want to do it. यहाँ पे parents का सबसे ज़्यादा एक patience acquire बहुत ज़रूरी है. So that is more important.
Okay. So, Dr. Meghna, what kind of resources are available to the families of children with autism, both in terms of medical care and community support?
See, in terms of community support, there are a lot of support groups now. I think they are there in many cities. Like one is Umeed in Mumbai, Action for Autism in Delhi, and they also give symptom signs, and especially this parental support is very important. The parents they get a hope from that these kind of other parents are also existing, and how many symptoms and signs can be manageable after the therapy, that also they can discuss with each other. And in terms of medical support, I would say rather than medical, it is more about the school support. That the children should be appropriately, once their at least irritability or you say the anger and hyperactivity is slightly managed by the medical therapies, they should be sent to the special needs school, because exposure other than house is very important for any growing brain, and those have to be seeked. That is what I believe. And apart from this, which I feel that there is certain financial support groups also which are available. Some trusts are also built up by the government, but I think we need more policies in terms of finance, because not every all the parents are affordable in that section, and many times this going to, I mean, putting them to schools and other activities may need financial support for two parents.
Thank you, ma'am. So, Dr. Richa, so what are some of the biggest challenges families of children facing with their autism, both in terms of accessing care and navigating social stigma?
Okay. So, as we know that many of the psychiatric illnesses, even all of the psychiatric illnesses, hold a stigma around them. And since we are, as we are progressing towards a better world, the stigma is reducing. But I don't think we are there yet, where the stigma has totally reduced around the psychiatric illnesses, whether it is present in adult population or it is present in child population. So as we talk about on the level, at the level of the child and at the level of the parents also, at the level of the child, as we know that autistic children basically there's a deficit in how they communicate with other people. If I say it in easy terms, they don't know how to carry on a good social conversation with their peers, with their teachers, with their parents. For a good social conversation, we need to understand the facial expression, the social cues which are presented to us. We need to initiate the conversation and also respond to what is being said to us and understand it. So they fail to develop this kind of ability. So they and as a result of which they fail to develop and maintain the relationships around them. So because of this deficit, they face a lot of outcast. They become an outcast in their school, whichever school they go to. Their peers outcast them. Their teachers treat them differently. The relatives around them, parents around them, everyone around them treat them differently, and also might say things to judge them and say things which are very mean. So it is at the level of the child and at the level of the parents also, because they have to deal with first of all the trauma of having a child with certain deficits, as Dr. Meghna, Dr. Manisha all talked about the acceptance part. Obviously, if their child is suffering from something, so they for a long period of time they stay in denial. It becomes very hard for parents to accept, and because of it, even if we counsel them about the illness, about the disorder, the society it's not there yet. It doesn't understand what autism actually is, where the child lacks. So the relatives and people around them, society around them, pass mean comments, which and it is basically this is the stigma which stays around the child population. And to deal with the stigma, I think first of all, as we talked about acceptance, so I would like to add a point. uh, as clinicians, we yes, we expect parents to have that kind of acceptance for the child, but sometimes we lack in providing hope to them. We failed sometimes to because of the time crunch or anything, but we fail to provide to make them understand that what are the positive points or what are the qualities that the child have, and what is the prognosis of the disorder. If as Dr. Sakshi also spoke and Dr. Manisha also spoke, it is a spectrum disorder. It can range from mild to severe, and not every autistic child suffer from intellectual disability or have any comorbid diagnosis with it. So many children have savant abilities also. Many children are very talented also, and with mild autism they can progress and become functioning adults also. So we fail to make sometimes we fail to make parents understand that the prognosis is also positive also, and we fail to give them hope. So I think as clinician we need to for parents to have that kind of acceptance, we need to provide hope to the parents. And yes, engagement with the child, and to reduce the stigma around it, I think this whatever we are having this sessions and the public speaking in schools, I think we can teach young children what autism is, how they can treat their peers who are suffering from certain deficits. We can make people and public aware of what mental health is, how they should not outcast people who are suffering from it, and make them understand about the emotions and the needs these people have. Yes.
Thank you, ma'am. So now I'll need only few short answers from Dr. Manisha and Dr. Meghna. Uh, how can society better support individuals with autism and their families, including through policy change or public awareness campaigns?
Autism Day, कल 2 April था. It was an Autism Day. So this is also an awareness program basically. And this such kind of awareness programs, I think, should be run more in schools, because this is very important uh, for other children to understand if some of a child is having this problem. then it's very important for them to understand that yeah, they should not bully that child. And जैसे उस जो बच्चा ऑटिस्टिक है उसमें एंजाइटी इश्यूज भी कई बार बहुत ज़्यादा हो जाते हैं, जिससे जितना वो परफॉर्म कर भी सकता है तो उतना भी नहीं परफॉर्म कर पाता है, बिकॉज चाइल्ड फील्स एंग्शियस and conscious also. And if there are no IQ issues, then child understands everything. तो अवेयरनेस प्रोग्राम किसी भी एज ग्रुप से किसी भी एज ग्रुप तक के लिए ज़रूर होने चाहिए। और स्कूल्स में, कॉर्पोरेट सेटअप्स में पेरेंट्स या जो केयर गिवर्स हैं उनकी एजुकेशन दिस वेरी इम्पोर्टेंट।
Dr. Meghna, your take
I
on
would
this one?
Yes, I would say educating them about the soft signs, because, as we said, because of internet and screen time, the symptoms are becoming very common. Maybe it is autism, maybe it is not autism like. So, soft sign and educating about them is very important. Second, proper developmental assessment visits in the first 1 to 2 years of life is extremely important. This vaccine लगा के जाना नहीं है. You should interact with the doctor also if you have any observations. And of course, screen time, we have it everywhere. We have written that no screen time under the age of 2 years. And fourth, I would say, if the birth history and if they have any family history of any particular genetic disorder or anything, they should be positively coming and talking about it. So there could be some counseling, because sometimes what happens, the first baby is autistic and the children, then there's a risk for the other child also. So if we can educate such parents, maybe their anxiety would be relieved, because it's not really true that the chances are there, but does not mean that every second child is going to be like that. So I think these sessions can be positively, the parents should come for help. That is what I would say in the first 1 year of life for the baby.
Okay, so before moving ahead, I would request all the audience to ask as much as question you want to. You can type your question in the comment box down below, and then we can take your questions from there. So, ma'am, Dr. Sakshi and Dr. Manisha, what are some of the most promising areas of research in autism, and how might these advances and our understanding and treatment of the disorder?
बेसिकली रिसर्च चल रही है इसका कॉज जानने के लिए, क्योंकि कोई सर्टेन कॉज अभी तक नहीं आया है। ऑफ कोर्स इसमें जीनोम सीक्वेंसिंग का रोल होता है, जो जनरल एक टर्म है, हम सबको ही पता है। और परमिसिव डेवलपमेंटल डिसऑर्डर है तो कुछ ऑर्गेनिक कुछ डिस्टर्बेंसेस होती हैं, लेकिन एग्जैक्ट कॉज क्या है वो रिसर्च इज ऑलरेडी ऑन, सो देयर इज नो सर्टेन cause so far is known.
I would like to say, as Dr. Manisha has rightly said, research is still going on. Some evidence are there that there is some genetic issue, could be one of the reason, and some environmental genetic issue also is there. But again, इसके ऊपर भी बहुत ज़्यादा अभी कुछ एविडेंस नहीं मिल पाए हैं, इसलिए अर्ली इंटरवेंशन एक बहुत ज़रूरी हो जाता है ऑटिज्म में, बिकॉज इसकी एक्चुअल रीजंस नहीं पता है। लेकिन अगर अर्ली इंटरवेंशन होकर उसकी ट्रीटमेंट पे वर्क किया जाए तो कहीं ना कहीं इस कंडीशन को हम एक बेटर फॉर्म में उसको फॉर्म कर सकते हैं, बेटर तरीके से।
And we
I
should
guess
certainly
we.
work on anxiety.
Yes.
Yeah. So, the last question from my question bank, like with Dr. Richa and Dr. Meghna, what advice do you have for parents and caregivers of children with autism in terms of educating for their child's need and finding the resource and support they need? Yeah. So, Dr. Meghna, do you want to take it first?
Okay. I would just say be hopeful, and always it's a teamwork. Not one single doctor is going to say, "Ki, yes, your child is autistic." It's not like that. So it's going to be a teamwork, and whosoever we refer to, like a psychologist or developmental pediatrician, pediatric neurologist, sometimes we advise for certain tests also to assess few things. You take those. And active intervention is the important part rather than, being very sad about the diagnosis because it's going to change the situation. So be hopeful. And one point I would want to add is that earlier it was thought that it is associated with vaccines, but it is not associated with measles, mumps, rubella vaccine. And please give MMR vaccine to your child. And that was a myth which is being corrected. That's it.
Okay, Dr. Richa?
Yes, as Dr. Meghna rightly said, be hopeful. And also, apart from being hopeful, I think I would like to advise parents to have a little fun with the child also. Because whenever the child is diagnosed with autism, the parents are then very keen to get the training done, get the therapy done, so that the child has a normal development. And in the process of doing so, I think the fun which lies in the interaction of parents and children, it goes away a little bit. So, and it is also, as ma'am said, that it is not because of vaccines. And there's also one more myth that it is associated with bad parenting also. But it is, autism is not associated with bad parenting. Many parents come and ask what we have done wrong, and is it because of the bad parenting? So it is not. And I think parents are the best therapist. I think they should work with the child very actively, and they should. Autistic child needs time, and it takes time to make them learn even the smallest of the things. So be patient and be hopeful, and carry on the therapy and have fun. That is all. Yeah.
Thank you, ma'am. So now coming to the questions we got from in chat box. So, ma'am, a question is: my son is autistic. He can't speak and very hyperactive and crying in the public and sometimes bite himself. Does any treatment in this problem? So, any of panelists can take
Uh,
want to take
I
this
will.
question? Yeah.
When it comes to hyperactivity, we need to work on the child's behavioral problem, right? And they are also asking about the therapy. They can go for the regular ABA therapy, which will help कि बच्चे के जो भी behavioral issue हैं उसको deal करने के लिए. इन दैट केस ऑल्सो दे नीड टू जो भी उनके डिस्ट्रैक्शंस हैं, स्पेशली जब बच्चा हाइपर एक्टिव है प्लस ऑटिस्टिक भी है, इस तरह के बच्चों को इस तरह लाइक कार्स है, व्हील है, ऑन द गो काइंड ऑफ टॉयज बहुत पसंद आते हैं. उनके डेली रूटीन में इस तरह की एक्टिविटी को मिनिमाइज करना चाहिए. एंड इनका आई कांटेक्ट बढ़ाने के लिए सबसे पहले इनका जो टीवी या स्क्रीन टाइम है, मोबाइल टाइम है, वो मिनिमाइज करके देर आर सम एक्टिविटी विच दे कैन यूज. एक छोटी सी एक्टिविटी फॉर आई कांटेक्ट मैं बताना चाहूँगी जो आप घर पे भी अप्लाई कर सकते हैं. जैसे एक बिस्लेरी बॉटल आती है, क्लीन बॉटल, उसमें आप 3/4 पानी भरिए एंड 1/4 आप ग्लिसरीन ऐड करके थोड़ा सा बबल, देन उसमें आप स्पार्कल ऐड हैं. और भी वैसी चीजें जो बच्चों को बहुत अट्रैक्ट करती है, लाइक सम सी शेल या सम सम गुड टॉय आल्सो इन दैट बॉटल, and close it and give that bottle to the child. While the child will rotate that bottle like that, तो उसका जो आई मूवमेंट है वो उस पे फोकस होगा. एंड विद इन 2-3 months you will see noticeable change in the eye contact as well. So बच्चों के साथ यू नीड टू वर्क फॉर द हाइपर एक्टिविटी एज वेल. आप ब्लॉक गेम्स ट्राई कर सकते हैं, ब्रेन जिमिंग कर सकते हैं. आप उनको एक्सरसाइज करवा सकते हैं. जंपिंग वो यूजुअली करते हैं, बट ट्राई टू गिव देम लाइक टाइम कि आप टोकन इकोनॉमी जिसको हम कहते हैं कि यू विल जंप लाइक दैट. तो हाई लाइक उनको 10 जंपिंग कराएं, देन गिव देम हाई फाइव, देन अगेन आस्क देम कि चलो ठीक है वी 20 जंप. उनको काउंटिंग समझ नहीं आएगी, बट दिस इज द वे दैट देयर मस्ट बी केयर गिवर लैंग्वेज और सम इंटरेक्शन में दे कैन इंटरेक्ट विद द चाइल्ड. इस तरह से उनकी थोड़ी सी हाइपर एक्टिविटी को कम कर सकते हैं. और प्लस उनका जो शुगर इनटेक है वो आपको थोड़ा सा कम करना चाहिए. तो कंपैरेटिवली अगर इस तरह से वर्क करेंगे तो बहुत सारे चेंजेस, लेकिन एक लॉन्ग रन में ही आप उसमें नोटिसेबल चेंज देख पाएंगे.
Oh, thank you, ma'am. So next question is from Mr. Vishal Pandey, and he's asking: His one of his friend in college used to talk with himself and sit at the corner of the class lonely. Is it normal or what? I guess it is related to mental health. So, Dr. Manisha or Dr. Richa, if you both want to take the question.
डॉक्टर रिचा आप कुछ बोलना चाह रहे हैं प्लीज?
Yeah, I think I actually जो question है, जो एक this is one of the symptom. I don't think कि if there's a mental disorder को हम एक symptom के basis पे diagnose कर सकते हैं. अकेला बैठना और अपने आप से बातें करना. I think this is one of the symptom which can be present in many mental health conditions. It can many people who are anxious they talk to themselves. Many people who are suffering from certain severe mental disorders there's severe psychopathology, they also talk to themselves because of the perceptual disturbances that they're having. So to call we cannot be sure of what this symptom indicates until we have more, I think, more history relating to it. Yes.
Yeah, basically
If you,
the history taken plays a very important role. So if the person is just sitting aloof in the corner and he or she is having self-talk, doesn't mean that certainly we cannot connect this thing with autism or any specific psychological condition. So history is very important, and what are other behavioral issues also, what are changes, recent changes in her activities, routine. So these are the very important things to know first. Then only we can diagnose what is the issue exactly.
okay. So, ma'am, next question is, can autism sign appears and leave? In other words, can a little one have them when he's 2 years and no longer have them at the age of 3 years? This question was asked by Mr. Ahmed Abdul Aziz. So, Dr.
Possible
Meghna,
first.
Acha,
Yeah,
yeah. So, Dr. Meghna and Dr. Manisha, you both can answer now.
and Dr.
Dr.
Meghna, please.
Manisha, you start, please. No problem.
या देर इज़ अ पॉसिबिलिटी, क्योंकि माइल्ड अगर सिम्टम्स हैं तो उसमें चेंजेस आ सकते हैं. और जैसे अभी कोविड टाइम में भी पीछे कुछ केसेस हुए थे, काफ़ी केसेस आए थे कि ऑटिस्टिक हैं बच्चे, ऑटिज्म करके प्रेजेंटेशन थी, लेकिन पता चला स्क्रीन एडिक्शन है, कोई ऑटिज्म नहीं है, हाइपर एक्टिविटी है, और कुछ टेंट्रम्स हैं जिसकी वजह से द चाइल्ड इज नॉट able to maintain the eye contact, and स्क्रीन इतना ज़्यादा हो गया है कि वो बहुत ज़्यादा मूडी हो गया है बच्चा. तो किस तरह के चेंजेस हैं, क्या इनिशियल सिम्टम्स हैं, वो डिपेंड करता है. डॉक्टर मेघना प्लीज. या ओवर
Yes.
टू यू.
See, it can happen, as ma'am said, about autistic-like features. Because autistic-like features, they will not constantly be there. Again, if there is some severity, then it is very severe cases. Few things like aloofness, not talking to others, not having good communication, not able to be friend with others. These things can persist. So such things we have seen. We have seen children of around say 2 years of age having not even equal मतलब repetitive words भी नहीं है, one word भी बात नहीं कर रहे हैं, and they are actually speaking few words which are directly taken up from YouTube, and they can be in any other language other than their mother tongue. They can be even other countries' language, a few words, and they are speaking those because they have heard it, and they are not speaking it with understanding, and the parents feel that the child is talking in a foreign language, but that is actually not so because there is no understanding about the words. And these symptoms have improved after similar ways of therapy, like speech therapy, improvement of eye contact, absolute of sugars, absolutely and slowly cutting down the screen time, and indulging them into the puzzles, etc. Things have improved that way. But certain features of autism per se, they will not improve after certain time without therapy. Rather, without therapy, it may happen that certain milestones of language which have been achieved, the child may lose them. something we call it as a neuroregression. So if actually there is an autistic baby who has not taken up any therapy or significant intervention, then they may lose what they have little bit achieved. So I don't think so. If there are core autistic symptoms, they will improve on its own in severe variety. Milder, yes. If parents have unknowingly done certain, like parents have put them in the play school, or they have made the environments better in the in house, then mild symptoms may show little improvement.
Oh, thank you, ma'am. So there is another question from Mr. Inder Khowal. He's asking, my brother is not able to speak properly and facing difficulty in communication with others, and what to do in.
Uh, I would like to take the question.
Yeah, sure.
First, if his brother, adult और आई एज्यूम कि वो अपने यंग यानी टॉडलर बहुत छोटे भाई के बारे में बात as a child, right? So intervention should be done. Not only only speaking, there must be some other issues as well. अगर हम autistic के term में बात करते हैं, because autistic में सिर्फ speech delay नहीं और भी developmental issues होते हैं. But still बहुत बार ऐसा भी हुआ है कोविड के दौरान स्पेशली कि बच्चों का स्क्रीन टाइम इतना ज़्यादा हो गया था उनका सोशल इंटरेक्शंस नहीं हुए देर इज ओनली वन वे कम्युनिकेशन while they were watching or listening any poem or watching any cartoon, so they are just listening. There is only one way communication happening there is no two way communication. तो वहाँ पे भी उनका स्पीच डेवलप नहीं हो पाया. लेकिन अगर हम स्पीच की बात करें तो स्पीच थेरेपी से बच्चों को बहुत बेनिफिट होता है. अगर चाहे वो बच्चा ऑटिस्टिक हो या उसको कोई डेवलपमेंटल इश्यूज हो या इन जनरल ऑटिस्टिक सिम्टम हो और उसकी वजह से बच्चा बोल नहीं है, स्पीच डेवलप नहीं हुई है, तब भी अगर वो स्पीच थेरेपी अक्वायर करते हैं देन डेफिनेटली वो उसके स्पीच में एक पॉजिटिव चेंज यानी कि इम्प्रूवमेंट देख सकते हैं. और घर पे अगर उस पर बात किया जाए कि व्हाट दे कैन डू एट होम, दे कैन वर्क ऑन द फोनेटिक साउंड दैट दे कैन टॉक लाइक साउंड. क्योंकि बच्चा सबसे पहले साउंड के थ्रू ही बोलना सीखता है. तो आप उसको एनिमल साउंड या फोनेटिक साउंड्स अगर आप घर में उस पर इस तरह से वर्क करें तो विद द हेल्प ऑफ थेरेपिस्ट डेफिनेटली तो उसकी स्पीच में आप
So that was the last question, and thank you everyone for tuning in. We hope this panel discussion has been informative and has helped increase awareness about autism. Remember, acceptance and inclusions are key to creating a better world for individuals with autism. We would like to thank our esteemed panelists, Dr. Manisha Singhal, Dr. Meghna, Dr. Richa, and Dr. Sakshi, for sharing their expertise on autism. We hope their insights have been valuable to our audience. Before we sign off, we would like to remind our viewers that autism is a spectral disorder, which means that each individual with autism is unique. We encourage everyone to learn more about autism, support individuals with autism and their families, and help create a more inclusive and accepting society. If you have any further questions and would like to know more about autism, please visit our website www.metrohospitals.com, where we have resources and information available. Finally, let us all pledge to do a part in promoting acceptance and inclusion for individuals with autism. We can all make a difference by educating ourselves and others about autism and advocating for equal opportunities for individuals with autism. Together, we can create a more inclusive and supportive world for all. Thank you for joining us today.
Thank you.